A new science shows taking aspirin is not that simple anymore. After years of recommending regular aspirin to prevent a heart attack and stroke, scientists now see little benefit for most healthy people. According to the U.S. Preventive Service Task Force, those over 60 should not start taking a daily aspirin to prevent heart problems. Those between the ages of 40 to 59 who are at risk should talk with their doctor. Joining us now, Dr. Carlos Santos Gallego, a cardiologist at Mount Sinai Hospital in New York City. Doctor, thank you so much for being with us.
Thanks for having me.
All right, so in this report, scientists say there's a dangerous health risk associated now with taking a daily aspirin in these age groups. That's based off of clinical trials. So, doctor, tell us, what is the concern?
Okay, the first message is that patients should not stop taking medicine on their own. They should have a conversation with the doctors. That's the overall message that I want to convey. Now we can go into the different age groups. In general, the efficacy of aspirin in preventing strokes and preventing heart attacks increases the younger the patient is. And the risk of side effects, mainly the risk of bleeding, increases with the older the patient is. That's why for patients over 60, in most cases, the risk of bleeding overwhelm are more important than the prevention that we are getting. That's why in these new guidelines, we are not recommending to initiate aspirin in patients that are over 60 years old. Now, this is very important. Patients who are already taking aspirin, they should not stop it. They should have a conversation with the doctor and determine what was the initial reason why they started taking aspirin.
Well, so doctor, as you mentioned there, obviously patients should not just stop what they're doing. They should speak to their doctor. But what about, the millions of people who have been taking that daily aspirin now up until this point? Should they be concerned?
No, the new guidelines apply to patients who are going to maybe initiate aspirin. Patients who are already taking aspirin, either because they already had a heart attack in the past, they definitely have to continue taking aspirin. And patients who they initiated aspirin in the past just to prevent the risk of a first heart attack, they should contact their doctors. So these guidelines only apply to patients who are right now not taking aspirin, and maybe, according to the old guidelines, they could start taking aspirin.
Ah, okay. So this is for people who are not currently taking aspirin. Okay, doctor, so despite this new recommendation, is aspirin still important if maybe you are trying to control other health issues like cholesterol or blood pressure?
So aspirin is useful to reduce the risk of heart attack. However, the most important issue is to have a global approach to the patient. So aspirin is important, yes, but reducing cholesterol with cholesterol-lowering medications is very important. Doing exercise is also very important. Controlling blood pressure is very important. Having a healthy diet is very important. So not only one piece of the puzzle is going to solve our lives for the future. Not aspirin is exclusively going to save our lives. It has to be the holistic approach to the patient, controlling all risk factors, cholesterol, diabetes, hypertension, exercising, having a healthy diet, what is going to help us. And aspirin is important, but it's only one piece of the puzzle.
All right, that is good sound advice. Thank you so much, Dr. Santos Gallego. Thank you for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.